Hello and welcome to the Autism News Network podcast. My name is Dr. Frampton Gwynette. You can follow me at Dr. Gwynette, that's DRGWYNETTE on Twitter and Instagram. I am joined today by a very special guest, Dr. Gretchen Gwynette. Welcome.
Hello, it's good to be here.
Yeah, we are really thrilled to have you. We've been following the coronavirus epidemic very closely, and we have a unique opportunity here to get two doctors for the price of one. So again, thanks for being here. Now, in case you didn't know, Dr. Gretchen Gwynette and I are married, so we're getting a husband and wife podcast today. So this is very exciting for me, personally and professionally. So just wanted to run over a couple of the updates on the coronavirus. As we know, this is a worldwide pandemic, and we are really in the grips of something that we've never seen before in our lifetime. Just to throw out a couple of numbers that are pretty mind-boggling. Today, Thursday, March 26th, 2020, the number of cases worldwide went past 500,000. So we're at 523,000 cases right now, so this is truly a public health crisis. The latest data we have for a full day was on March 24th, so Tuesday. We had 50,000 new cases worldwide. And a new dynamic has emerged in the last probably 1 to 2 weeks. We've not only seen Italy be a major driver of new cases worldwide, but the United States is now responsible for about a fourth of all new cases across the globe. So the United States and Italy are now running a very close second and third to China. And China hasn't had a lot of new cases, has it, Dr. Gwynette?
No, it hasn't.
Yeah.
So there is talk that sometime this weekend that Italy and the United States could pass China in the number of cases.
Yeah, and that's really beyond terrifying because we always thought of this as like a Chinese virus and a Chinese disease, and now it's, by definition, the United States will probably be the majority of cases going forward. So pretty scary to think about.
Yes, it is.
Yeah, so interestingly, Italy has the number one most deaths so far, with over 8,000 deaths. The United States, although having being in third place for number of cases, is only in sixth place for the number of deaths. So we'll have to see. America's healthcare system is really going to be put to the test. Have you heard, Dr. Gwynette, about all the stuff happening in New York and all the drastic measures they're taking? And
there are many states, including, I know, New York, California, Illinois, that have all done lockdowns, that they have officially closed non-essential businesses, all in an attempt to control the number of cases, because we really have never seen something like coronavirus on how contagious it is. And also, most individuals have it for several days before getting any symptoms. So that is also very scary, because then they're passing the coronavirus on to other individuals with, that neither one are having symptoms.
So they're feeling well, maybe not even any fever, but they can definitely pass the virus on to others and then develop symptoms later.
Correct.
Yeah.
Correct. And that's one of the biggest reasons why this is so contagious. And I think they're making the correct decisions to do the lockdowns. I know it's very difficult financially for our country and what we're going through, and individuals, not getting the paychecks, which is just horrible. But sometimes I read once that it said the coronavirus might be taking away our livelihood, but at least it's not taking away our lives.
Yes.
Of trying to say, listen, we all have to look at the big picture of what this means, and to try to be safe, not only for you and your families, but also for just the well-being of many, many others.
Absolutely. That's a great, little words of wisdom there. I like that. Where we stood last Friday, it's kind of interesting to watch the trend. In America, United States, last Friday had 8,000 new cases, and then over the past weekend, the number of cases accelerated to the point that on this past Tuesday, 2 days ago, we had 12,000 cases. So we're moving from 8,000 new cases a day a week ago to over 12,000 new cases a day in this country alone. So we're really seeing an acceleration despite the lockdowns and despite the social distancing that we're all feeling. So really, do you chalk that up to more testing, or do you think that more people are getting sick?
Well, I think it's both. I think you have to realize when you're looking at the United States, our ability to test for this disease, as many hospitals are rapidly trying to get approval so they don't have to send out the test, so they can get the test sooner. And this number really is going to really markedly increase as when they have the rapid coronavirus tests that they're projecting in about a month,
right,
that they can get the results in a few hours. Obviously, that will be huge and hopefully slowing this down so that people can immediately start quarantining themselves.
Right.
Yeah.
Yeah, and we had an interesting little story today from a family outing where we went to Target to pick up in the parking lot. They can actually bring the packages out to you in a drive-through manner. And it actually works really well for the audience members listening, that you use the app and then you send them a message in the app when you're ready, and then they can bring it right out. But then something interesting happened right as we were loading up our car, right? Do you want to tell the audience?
Yeah, so I look over and I see a husband and wife putting stuff in their car. And I ask, is that toilet paper or paper towels? And they said it's toilet paper. I think there's 2 more left, and there's only one package of toilet paper per person. So
yeah.
I had, Dr. Gwynette Frampton run in, and he did get the last one.
Yep.
You never thought toilet paper could be such a commodity.
Yeah.
But yeah, why don't you tell about the individual?
Yeah, on my way into the store, I passed another woman who had a roll of toilet paper, or a package of toilet paper, and I asked her, I said, I'll give you $100 cash for that. And she said, no way. And I was only kidding, but that, I think, speaks to how I think panicked people are about bathroom tissue. And when I did go in the store, the store worker told me that they had none, but I checked in the very corner bottom of the rack, there was one more package. So I felt uneasy about going into the store because the whole purpose of the trip was to avoid contact with other humans. But once I was in there, I bought a whole huge shopping cart of groceries because I probably got anxious. Like, this might be my last trip into the store for a while. And so I loaded up on things like butter and snacks and canned goods, some of the luxuries that we haven't had the last week or so as we've depleted our supply of food. So that was kind of interesting.
Yes.
But yeah, so the social distancing is definitely taking its toll. Have you heard much, Dr. Gwynette, about like people losing their jobs or restaurants struggling?
Yes, unfortunately, and I know they're calling it furlough, that individuals who have been such crucial parts of different businesses, that as businesses continue to, whether it's they've got a mortgage or rent that they need to pay, but especially the mortgages, I know can be very overwhelming. I am glad that the United States are trying to work through something to help so many. That is financially, this is a huge, decrease for them. So yeah,
exactly. I've heard stories of engineers getting laid off. We heard about restaurants essentially closing down. Heard about people being furloughed. Sports teams are shut down, so coaches, schools are shut down. So it's just really the economy is at a crawl and at a standstill. And what's been your reaction? You've seen the stock market, what it's been doing the last couple of weeks. And what's your take, just big picture, in terms of what's happening on the stock market?
Well, I think there's a lot of fear going through all of us of wondering if this continues, how our even businesses we're involved with, even in medicine, how are they going to be able to continue to pay if money is not coming in? And, the stock market did end today very high compared to what's been going on, because it looks like that the stimulus package is getting closer, and that becoming a lot more bipartisan, which is going to be essential for this to work. So
yeah, it's funny when you think back. I always hear stories of World War II and how the country really pulled itself up by the bootstraps, and you had women manufacturing warplanes, and everybody was working together. There were rations on things like pantyhose, so the nylon could be used to make parachutes, and there was rations on just about everything. But you never heard things about division in the country during World War II. And here, I wonder if, since we're facing really the fight of our lives, if we're eventually, not yet, but eventually going to see some more unison that we're all in this together.
Yeah, I agree. I hope so. I think, we've been too far on different ends for too long now. And to try to, like you said, we're all going through this and see how we can all work together for the best, not only of our country, but our families. A thing that was interesting to me that I should have mentioned earlier when we were talking about how contagious it is if you look at that, the average infected person goes on to infect about 3.5 other people.
Yeah, those numbers are amazing.
Yeah, exactly. So really, for this pandemic to stop, you need that number of others being infected less than one. Ideally,
right.
You want it none, so then it just stops in its tracks. So.
Yeah, and that brings up a contrast between Western civilizations and Eastern civilizations. One of the things that I've been reading about is how they got a handle on this over in places like China, which had a huge problem early on, but also places like South Korea, places like Singapore and Japan, because there's been no major outbreaks in those countries for several weeks, maybe upwards of a month. And it sounds like there's different emphasis on personal liberty in the East versus the West, and there's different emphasis on kind of a respect for the culture as a whole, and I guess people sometimes will concede to the state, like what's best for the country versus what's best for me. And I've heard in Italy that people were initially hesitant to really do lockdown measures, and the government doesn't have a role to board people's houses up and quarantine them, and so the virus kind of got out of control. What's your take right now? Where do we stand in terms of an individual's rights versus like what's best for the country or what's best for the county? Yeah,
I mean, I'm big on the big picture. Mm-hmm. Everyone's, whether it's the county, state, United States, the world, of trying to make the decisions that work best for everyone. I'm actually a proponent. Honestly, I think they should have a lockdown because it's the rationale of saying, why do we wait until we're New York City,
right,
or other of these areas that have been so heavily hit? Because like we just said, one infected person goes on and infects 3.5.
Yeah.
And when you think of how exponentially that can quickly get out of control, so I mean, I do know it's hard, but I actually think having a lockdown across the United States would be beneficial to make this quicker to the end and make it that people get back to their jobs, and places that have been closed will hopefully will be open again. And I think that's a big thing when this does come back, is trying to really support these restaurants and support these places even now to try to help these individuals.
Yeah, exactly. One of the techniques that they used in China especially is called contact tracing. So and this is one of the benefits, if there are any, of being in a communist dictatorship. The state has so much control over there that when a case was identified, they had the resources and the manpower to literally track down everyone, find out where they were, who they talked to, and quarantine not only the people who were symptomatic, but also the people who had, for a fact, been exposed. And they created huge hospitals and huge areas in gyms and public places where they could quarantine people and trying to separate the sick from the healthy, which is really, it's not going to fly here in the United States currently. But I guess it really depends. As we're passing the total number of cases in China, we may have to rethink our strategy and get more drastic.
I definitely think that trying to track down the individuals, especially, and see who's been exposed and have individuals quarantined and tested.
Yeah.
Let's have them tested instead of them, continuing to spread to other people. I do think you're probably right. It's probably the only benefit of a communist country that they just really, I know America's taking it serious. I don't think it's maybe as serious as, what China has done to really decrease the coronavirus within that country. So,
yeah, exactly. And then bringing the focus back to South Carolina, we now have 425 reported cases. This is as of as of today at 3:00 p.m. So 425 cases, 9 deaths. And again, we see counties that are somewhat surprising leading the way, like Kershaw County is number 1. That's been the epicenter. But now the larger metropolitan areas are catching up with Richland County, that includes Columbia, Charleston County, and then Greenville County. So we're seeing the bigger cities being more impacted. So generally, the closer people live together, the more episodes we're going to see of the virus. In the smaller areas where people are more spread out, it doesn't seem to spread as fast. So that really mirrors what we're seeing in New York. And do we have, I know there was some hope, maybe there were some treatments on the horizon. We heard stuff about Plaquenil and Z-Paks. Any other treatments out there that our audience should be researching online?
Well, no, I wouldn't really say research it yet, because literally medicine is researching it. I know that Columbia University in New York City, I believe it's this past Monday, started doing double-blind controls to see about the Plaquenil and the Z-Pak. Z-Pak is an antibiotic that's given over several days. Your first dose is the highest, like it would be 500 milligrams, then going down. And where they got that from is actually France has seen decreasing the longevity of coronavirus in their patients. And what that ultimately means is you're not going to get as sick. So if we can curtail that and shorten this, you're not infecting people as long, but also, again, instead of it going to a really bad pneumonia or things that our body can't control as well, and really our immune system is not fighting as well, especially when it comes to the individual's 60 years of age, but that the number of deaths that occur 60 years of age and older. And but I read research that they were looking at, I believe it's 25 years of age to 60, and that was a third of the hospitalizations, clearly meaning you're a lot sicker if you require hospitalizations. So
it is scary to think about young people getting sick. I think one of the things that got the world's attention was when that 33-year-old ophthalmologist in China, who was one of the early identifiers and whistleblowers in China, succumbed to coronavirus at age 33, which was pretty unbelievable. So in terms of the death rate, we're having a very difficult time getting a handle on the death rate because, like Italy, for instance, the death rate appears to be about 10%, but we know that Italy has an older population. They have a higher rate of smokers, and most of the people who do die of coronavirus have other underlying medical conditions like heart disease, diabetes, asthma, COPD. So, generally younger people are going to fare better, but the older the population, the more vulnerable. So it's really scary to think about, and we just don't have a true mortality rate yet, do we, Dr. Gwynette?
No, it's just still a huge increase of cases, and time is going to tell. And for us to have better data to really look at this and use our own data, not just a lot of the data was initially based out of China, and that was extremely scary. That it showed at that point, 80 years and older, it was 15% death rate at that really point. And it was 3% from 60 years of age to 79 years of age, which is really high. Yeah. We've not seen infectious diseases like this, especially how quickly the illness is. This is not a long-term HIV, and that has totally changed by treatments, but I'm talking about way in the beginning. When they were trying to discover stuff about HIV is the same kind of where we're at right now, trying to figure out and better understand the coronavirus to be able to make the best decisions.
Yeah, and it does take years to come up with good research, and that's something the audience needs to bear in mind, because there's what we call anecdotal evidence, which means you hear a story that something worked, and then the pathway to getting really true good evidence takes years, because they need to do controlled trials, which means you have a treatment group and a group that doesn't get treatment, and then you have to blind the patients to account for the placebo effect. You have to blind the doctors, which makes it double blind, placebo controlled, and those studies then need to be, you might get one, but you want to have multiple studies in multiple locations, so it needs to be replicated. So getting all that done takes years, doesn't it?
Well, I think they're going to expedite this. I don't think we're going to do it nearly as much long-term. Medicine, when I say we will do that. But I think if they do start finding that they're having patients that the longevity of the disease is shortened, that they might decide, the FDA, that maybe we should roll this out a little sooner than, because the wonderful thing, by the way, these are not two medications that are new. These are medications that have been around for a long time now, and they are looking at other medications. I mean, even some I was reading about cholesterol medications, which the mechanism of action I'm not really sure yet, but But
it would be surprising if those worked.
Yes, I would be surprised. But the Plaquenil, that for a long time was an anti-malaria medication, and then the antibiotic. I think when you're adding the Z-Pak on top of that, you're preventing the secondary infections that the virus makes you susceptible
like
to.
The pneumonia.
Exactly, preventing the pneumonia.
Yeah.
So.
Well, that's really interesting. So we'll look for new treatments. I do feel like medicine, at least in the United States, is pulling all the stops. Like when I went to the New England Journal of Medicine website, like almost all the articles are about COVID-19. We're seeing in MUSC and in psychiatry, rules and regulations are being dropped so that we can provide telemedicine, visits to our patients with as little red tape as possible, because our patients do need care. So I do feel like all hands are on deck, in terms of the resources we have in the States, and we just need to keep working together. Well, very good. Well, I wanted to thank our audience for joining us, but before we wrap up, I just have one other question for Dr. Gwynette. Can I have a kiss?
All right.
There we go. That's a unique opportunity. So I wanted to thank our audience for joining us here on the Autism News Network podcast. You can follow me, Dr. Gwynette, at Dr. Gwynette on Instagram and on Twitter. I want to thank our special guest, Dr. Gretchen Gwynette, for being here. Any words of wisdom, Dr. Gwynette?
No, just thanks for having me, and just continue to stay safe and healthy, and really doing the social distancing and trying not to expose yourself. And, a big thing we should have said, but I think we've read it so much, is wash your hands, wash your hands, wash your hands. Yeah. Do 2 birthday songs, 20 seconds. It's actually, I was surprised when I timed of like, wow, that is a really long time of when I think most of us wash our hands. So that is making a huge difference there. Absolutely. Well, thank you. And thank you to the audience for joining us on the Autism News Network podcast. We will see you next time. Thanks.